Okay, now today we will discuss the mediastinal anatomy on a CT scan, and mediastinum is one of the most important part that is asked to undergraduates, postgraduates, and I'm sure there are a lot of spotters which can be formed on basic anatomy of mediastinum. So to show you the anatomy of mediastinum on a CT scan, I'll use a contrast enhanced CT. This is the topmost scan where we are able to see the bottom of the neck. This is a cross section, transverse section, where we are able to see the shoulders, and you can see the cervical vertebra, larynx. You are able to see the common carotid artery and the internal jugular veins, and this is the sternocleidomastoid muscle. Now if I go to the next slide, now further we go down, we are able to appreciate the common carotid artery, internal jugular vein, and the sternocleidomastoid muscles. I go down, now you are able to see this hyperdense structure appearing here, and the central air filled column is the trachea, and this is, you are able to appreciate the thyroid gland here. I go down, you can see the thyroid gland better. Because of the iodine content, thyroid gland appears hyperdense on a CT scan, and this is the air column. And I go down, and can you see the thyroid isthmus now? This is the thyroid, right lobe of thyroid, left lobe, and you can see the thyroid isthmus, common carotid artery, internal jugular vein, and the dye has been injected on the left side. And we go down, you can see the thyroid gland, you can see the internal jugular veins, you can see the common carotid artery, and we go down, you can see the contrast in the left side. Can you see the contrast in the subclavian vein crossing? And if we go down, this is the tracheal airway, common carotid artery, the ribs, the thoracic vertebra, the clavicle, you can see the glenoid, this is the scapula, and this is the humerus, glenohumeral joint. And we go down, we can see the vertebra, thoracic vertebra, ribs articulating with it, and we can see, if I go down, you can see the brachiocephalic vein from the left side crossing over and joining the right side brachiocephalic vein to form the superior vena cava. This is the superior vena cava, and if I show you here, this is the right brachiocephalic artery, left common carotid, left subclavian, trachea, esophagus. And we go down, you can see the ascending, you can see the the brachiocephalic artery and left common carotid, they seem to have a common origin from the arch of aorta, and anterior to the arch of aorta you can see a triangular gland which is the thymus gland. These are the breast shadows. You can see the right lung, the left lung, you can see the ribs, the scapulae, the thoracic vertebra. This is the trachea, and you can see the esophagus posterior to the trachea. As I go down, you can now appreciate the superior vena cava well here. Thymus, triangular shaped thymus shadow. You can see the arch of aorta. Now you can see the arch is dividing into the ascending part and the descending part. You can see the trachea is bifurcated into two, and you can appreciate the superior vena cava. You can see the ascending aorta, the pulmonary trunk. Now if I see, you can see the pulmonary trunk is dividing into the left branch and the right branch. And as I go down, you can see the esophagus, descending aorta, ascending aorta, and you can see the part of the right atrium here, And if I go down, this is the left atrium. You can see the pulmonary veins opening into the left atrium. I go down, you can see the left atrium, descending aorta, esophagus, and you can see the right atrium, right ventricle, left atrium. And we go down, you can see the interventricular septum well, you can see the left ventricle, right atrium, and the left atrium. And if I go down, you can see the right atrium is continuing into the, you can see the inferior vena cava, and this is the hepatic part of the inferior vena cava, esophagus, descending aorta. And now you are able to appreciate the liver on the right side. This is the superior part of the liver that you can see. You can see the IVC, you can see the hepatic veins opening into it, you can see the gastric shadow, the splenic shadow is evident now on the left side, and this is the lung base on the left side. And if we go down further, you can see the pancreas, left kidney, splenoportal axis, inferior vena cava, you can see the adrenal glands, and the right kidney is now evident. So, and you can see the inferior vena cava, you can see the left renal vein crossing over and joining the inferior vena cava here. And to end the discussion, you can see the aortic shadow here, you can see the left renal vein, both kidneys are showing contrast enhancement, and that was the purpose of the entire show here. Was I wanted you to see how mediastinal structures are placed on a CT scan, so that if you get a question on identifying a structure, you should be able to do them on any section on a CT scan. Thank you very much.